Tonight I have the pleasure of introducing to you, what is he looking for, Marty? The basket? It bypassed you. You mean you didn't get to contribute?
No, we have money.
Well, whoever has the basket, would you bring up to Dr. Weissman here? He wants to put some money in. Okay. Tonight I have the pleasure of introducing to you Dr. Leonard Ling. If you can hold any questions that you have until the end of the presentation, we'll give you a chance to ask your questions after the speaker is finished. What we'll do is have him stay here and have, I don't know how we're going to do it without a mic today. I guess we'll just have you come up here and ask your questions so he can hear you, because there's not a lot of distance here. Dr. Ling has one of the most impressive resumes of any of the speakers we have previously had speak to us. Obviously, I can't give you the whole thing, but I'll give you a very brief synopsis. His language ability alone is impressive. Of course, he speaks English, and he's fluent in Spanish. He spent a year studying in Madrid, Spain. He speaks Mandarin Chinese and is fluent in Taiwanese. Wow, that's a mouthful right there. Dr. Ling graduated medical school from the University of Michigan in 1996. He did his intern residency in general surgery at Kaiser Permanente Medical Center in Los Angeles. He completed his residency in urology at Kaiser Permanente Medical Center, also in Los Angeles, and was the chief resident at Kaiser Permanente Medical Center in 2001 and 2002. He completed his fellowship in renal transplantation in 2004 at the University of California, Los Angeles Immunogenics Center and Westwood Medical Center. Dr. Ling is presently a transplant surgeon urologist with the volunteer attending staff at Harvard UCLA in Torrance. Dr. Ling was a transplant surgeon at St. Vincent's Medical Center, Multi-Organ Transplant Center until 2011. And of course, is board certified by the American Board of Urology. I would be remiss if I didn't mention the fact that I have to admit all the medical positions, publications, and abstracts and the clinical research project he has completed over the years. But they are way too numerous to mention in the time I have allotted for this introduction. Tonight, Dr. Ling will tell us how our own immune system can fight advanced prostate cancer with the help of Provenge. It is with great pleasure that the Prostate Forum of Orange County presents to you Dr. Leonard Ling.
Indicated for, essentially it's indicated for men who have prostate cancer who have three things. Number one, that it's metastatic. That means it's spread beyond the prostate gland. Number two, it's hormone refractory. We usually say castrate resistant, but what that means is that it's no longer responding to the initial hormone treatment. And number three is that it is asymptomatic or mildly symptomatic, which means it's not causing so much pain that you need to take narcotic medications. So it's a fairly narrow indication. Most people who have prostate cancer are not advanced so much that they would require or be a candidate for a Provenge. But what I think is interesting is that a lot of men that I get who I eventually give Provenge to had no idea that Provenge was even available for them. They had never even heard of such a thing. And so I think events like this are important. So these are the questions that I hope to answer during this talk. Number one, how are the different options what are the different options in treatment for prostate cancer, what exactly is Provenge, how does it work, what the experience is in giving Provenge, and lastly, what are the financial factors that you have to talk about, and what kind of assistance is available. So first, some demographic information. About 1 in 6 men in America will be diagnosed with prostate cancer. That's a lot. Of those, 1 in 3 who have some sort of treatment like radiation or surgery will have their prostate cancer return or come back. So they won't be cured by their initial treatment. And out of those patients, 4 in 5 will eventually have advanced prostate cancer or cancer that has spread to other parts of their body. So what we call the clinical course of prostate cancer can be essentially simplified to early and advanced prostate cancer. Early prostate cancer is only in the prostate and there's no cancer-related symptoms. Advanced prostate cancer has spread beyond the prostate and you may have cancer-related symptoms. So about 5-10 years ago, really, there weren't many treatment options for patients who had advanced prostate cancer. Now there are a handful, of which Provenge is one of them. Number one, there's immune therapy, which activates a patient's own immune system to seek out and attack prostate cancer. And the other two are some sort of hormonal therapies and chemotherapy, which chemotherapy introduces chemicals into the body that kill directly cancer cells. Hormone therapy stops prostate cancer from growing by blocking the hormone testosterone, the male hormone that feeds prostate cancer. So now you may be thinking, what is Provenge and how does it work? This gentleman actually is a prostate cancer survivor who has had Provenge treatment. I'm told that you can go on the Provenge website and read all about his story and all the details about his treatment. So Provenge is the first FDA-approved immune therapy for advanced prostate cancer. In fact, Provenge was the first immune therapy for any solid organ cancer approved by the FDA. And the goal of personalized therapies like Provenge is to give safe and effective ways to treat patients by using their own immune system. Now, just think about that for a second. It's a whole new paradigm in cancer treatment. Before, doctors really could only do 3 things. Number 1, surgery, which is to cut out prostate or cut out cancer from a patient. Number 2, chemotherapy, giving some sort of chemical to kill cancer cells directly. Number 3 is radiation, zapping with some sort of radiation energy. But Provenge is different in that it's personalized. It is made according to every individual's immune system. So it's actually customized therapy. And what it does is uses your own immune system to fight the prostate cancer. And we'll go into this indication in a little bit. But I want you to understand how this really is a new paradigm or a new way of treating cancer that really hasn't been used more than 10 years ago. This was not used at all in any kind of cancer treatment. So what does it do? So here's an immune cell, and you see how it went over and is attacking viruses and bacteria. This is what our immune system normally does. So what Provenge does is that what happens is a lot of time our immune cells don't recognize cancer because it hides, it evades detection. And so what Provenge does, it teaches your body's immune system to find these cancer cells that are hidden and to seek out and help attack them or suppress them. Let's see. Okay. So what Provenge does is it takes your resting immune cell and it teaches your immune cells to recognize and attack prostate cancer. This is a very simplified slide. What really happens is pretty complicated, but for everyone's real for all intents and purposes, you don't really need to know all the nitty-gritty details. But this shows essentially what happens is that a resting immune cell will attack prostate cancer, but then after it gets taught how to recognize it, essentially an antigen is introduced to your own body's immune cells, and it teaches those cells to find prostate cancer. So that's what it does. It trains your immune system to seek out and attack prostate cancer cells. So a way to think about it is that it's different from chemotherapy in that it doesn't give chemicals that poison prostate cancer cells. What it really does, it jumpstarts your immune system to attack advanced prostate cancer. This is the guy who's in the commercial for Provenge. I don't know, has anyone here seen an actual commercial for Provenge? Raise your hand if you have. Okay, so a couple people. So yeah, there's a commercial going out that targeted for people who may be interested in prostate cancer, and this is the guy pulling jumper cables. So one thing to keep in mind is that men with prostate cancer tend to be obsessed with their PSA numbers. And this is a lab test that is used to kind of keep track of your prostate cancer. And so what you need to know is that even if your PSA doesn't go down with treatment of Provenge, that doesn't mean it hasn't worked. It doesn't mean that it hasn't helped you live longer, because the real goal of treatment is not to lower a lab number or to lower your PSA. It's to help you survive longer with few side effects. And that's really what Provenge does. So here's a graph. I don't know if you guys can actually see the numbers, but after 3 years, the main number to take from this is that after 3 years after the start of the clinical trial, Provenge reduced the risk of death by 22.5%. So your chance of living was significantly higher at the 3-year point if you had Provenge compared to if you did not have Provenge. And this was a randomized, double-blind, placebo-controlled study, the gold standard in medical studies. So this is really what got Provenge approved by the FDA. Yeah, I have to talk about side effects. Provenge has relatively mild side effects, especially compared to chemotherapy. Most common side effects are flu-related, chills, nausea, fatigue, but really mild, and very few serious side effects. In fact, only about 1% of Provenge patients had to stop treatment because of these side effects. My own experience, I've given Provenge to 9 patients in my own practice, and all of them really have gone through with flying colors. I had one patient with just temporary hypertension, and that was basically it. Really, really well-tolerated treatment. And so here's a slide with some of the nitty-gritty stuff. So when is the right time to think about Provenge? The national guidelines for cancer recommend Provenge as the first option. for advanced prostate cancer for men with few or no cancer-related symptoms. That's a Category 1 recommendation. These are not guidelines put forth by a pharmaceutical company. These are guidelines put forth by the National Cancer Society, NCCN stands for National, someone help me out here.
Comprehensive Cancer Network.
Yeah, that's it, National Comprehensive Cancer Network. This is the top cancer experts, and really supposedly with no hidden agenda. And they have recommended Provenge as the first treatment for men with advanced prostate cancer who are asymptomatic, who are relatively healthy. So to find out if your cancer is advanced, it's recommended to ask your doctor about certain things such as bone scans, and bone scans will, give important information to see if you have cancer that's spread beyond your prostate. Why are bone scans important? Talk about that. And, essentially, bone scans are important if you think you may have advanced prostate cancer. Okay. Next. This is another guy who got Provenge. His stories on the website. What will you experience if you are treated with Provenge? Well, each dose of Provenge is personalized for the patient. So even though you get 3 doses, each single dose is once again personalized or custom made for you. What happens is that day 1, your cells are collected at apheresis center, kind of like getting like if you go donate platelets, it's kind of like the same place where you go to donate your platelets. And so they filter out your immune cells, and between days 1 and 3, the process is done in a dendrion lab/factory. And on day 3 and 4, it's shipped to wherever you're going to get it. In my case, it's shipped to my clinic, and I give it in my clinic in a room specialized for giving this sort of thing. So it's pretty simple. The only complicated part is how it's manufactured, and the patient really has nothing to do with that. But the day 1 and day 3 is the days that the patient is involved in. That's pretty straightforward. So in all, there's basically 6 days that a patient has over a period of about a month, and then the treatment's done. So compared to chemotherapy or radiation therapy or anything like that, it's really straightforward and pretty fast, actually. So this is how explanation of what I just went through. Cell collection, blood is drawn through a machine and harvests your immune cells. It takes a few hours, and it's performed 2 to 3 days before Provenge is given. These are a few tips on the day of leukapheresis. Basically, you have to be hydrated. You want to make sure you have enough calcium in your system. And that's about it. It's pretty straightforward.
The effect's pretty small. Can you read those?
Oh, sure. Okay. So on your day of leukapheresis, you want to make sure to drink more water than usual 2 or 3 days before to be well hydrated. Avoid caffeinated beverages. Eat a calcium-rich breakfast, milk, orange juice, cereal, bananas, blueberries, almonds. Wear comfortable, loose-fitting clothing, especially at the sleeves. And have a driver lined up for the ride home, since most people feel fatigued after the cell collection procedure. That being said, I've had patients drive themselves. It's not a impossible thing at all. Patients can drive themselves. What to expect on the day of the infusion. Appointment lasts a couple hours usually. It takes about an hour to infuse Provenge totally. You get a Tylenol or a Benadryl half hour before the treatment, and you stay about half an hour after the infusion to make sure everything's okay. So getting the infusion is pretty straightforward too. And so in total, after 6 appointments, your treatment with Provenge is complete. So this is like a sample treatment schedule. This is 1 month. Let's say on the first you got your first leukapheresis, then 3 days later you get your infusion, and that procedure is repeated 2 weeks after and 2 weeks after. One thing to keep in mind is that this amplifies your treatment. It's sort of like these cells get trained and your body reacts, has an immune response. And then those cells are again, like your body again is given the treatment and then is given again. So it's kind of sort of a logarithmically amplified during your treatment. And one important thing to note is that unlike chemotherapy, Provenge continues to work even after the last dose is given. Actually, there are some studies that show Provenge, the immune response that Provenge has given, still working. Officially, I can say 6 months, but there are some studies that show 2 or 3 years after the Provenge immune response is still detectable. Okay, so the last thing is the financial assistance. A lot of people have heard that Provenge is extremely expensive. Okay, I'll just get that out of the way. Provenge costs whoever gives it over $90,000. So for a Provenge provider like myself, for me to buy Provenge, it costs me $90,000, which is a lot. But for the patient, that figure should not scare you away from trying to get Provenge if you are a true candidate, because most patients really have no out-of-pocket costs because the coverage from insurance companies and Medicare is very good. So I will tell you, out of the 9 patients that I've given Provenge to, none of them have had out-of-pocket costs, 0 out of 9. Officially, they've figured out that 75% of patients have 0 out-of-pocket costs, and then 25% have minimal out-of-pocket costs. So here's a graph here of what I just said. About 75% of patients have 0 or minimal out-of-pocket costs. Medicare covers Provenge, and about 99% of all healthcare plans, Blue Cross, Blue Shield, United, Aetna, they all cover it. So really, financial considerations should not be an obstacle for a patient who's a candidate for Provenge. Yes?
What about if you belong to an HMO?
Yeah, I have a patient who has an HMO, and that patient eventually was covered. And it's a little bit more painful to go through for HMOs because honestly, they seem to be reluctant to provide coverage for patients who are candidates. But you just have to be persistent, and if you really are a candidate for Provenge, you will be able to get that. Yes?
Is the procedure ever repeated, or is this just once per?
Yeah, that's a great question. The procedure has been repeated, sort of like a booster for a few patients that I've heard of, but that's not part of the standard protocol. Usually it's given, and then that's your kind of lifetime treatment.
Does it have any impact on subsequent therapies?
No. Yeah, it's another great question. You can give, just because you got Provenge doesn't mean you can't get other stuff later. You could still get you can also get chemotherapies. You can also get testosterone treatments like Zytiga, Xtandi, whatever, you know, these treatments are all for advanced prostate cancer. You can still get them after you get Provenge. Yep.
Can you go through this process while you are on some other hormone therapy?
Yeah. It's recommended to continue your hormone therapy while you're getting Provenge. So let's say a common hormone therapy is Lupron. If a patient is on Lupron shots, it's recommended to continue those Lupron shots while you're getting the Provenge treatment.
The only treatment that you want to stop is steroid.
Yeah, right now it's considered standard to stop steroid treatment if you're going to get Provenge. That hasn't, you know, that may change in the future, but for right now, it's recommended to stop steroids because steroids suppress your immune system. You want your immune system to be as robust as possible before you get Provenge. So it's recommended to stop steroid treatment 1 or 2 months before you get Provenge.
Do you have any statistics which would determine whether a person would be better off having had Provenge versus not having it over a period of some time? Do I understand? Do you understand my question? I can reiterate it. Julie.
Sure.
The question really is, if prostate's a chronic disease that we're treating for years and years, in my case it's been 15 years.
Sure.
Why would I want to do this when there are other things available? I mean, is there any efficacy to heighten other treatments, or is this itself going to help me get off of other drugs? And what statistics do you have to prove any of that?
Yeah, I mean, there's a whole plethora of statistics that show that Provenge is effective. The study that, I don't want to go too much into all the numbers, but the study that showed that Provenge was effective had about 250 men who got Provenge and 250 men who didn't. Actually, a lot of those got sort of like a weakened version. But it showed that the men in the control group did not live as long as men in the Provenge group. And this was a randomized study. They were very well matched. And that's basically what got Provenge approved. There's been a lot of studies for different agents that show PSA going down, okay? And, but with no survival advantage. So the reason that Provenge got approved, and that's why we're giving it, is because it extends survival in men with very few side effects. That's the reason why you would get it. Now, most men who have prostate cancer are not candidates yet right now because their disease is not advanced enough, okay? But
what is that, when you say not advanced as much, what does a patient look like who's got advanced prostate cancer who would want to take Provenge?
yeah, they probably look
They
like
metastasize?
people here. I mean, they look,
Are they metastasized? Or
right.
Are they have a large high PSA? Or?
not necessarily. You can have, and actually, it's better to have a lower PSA and to be healthier to start Provenge. Those men were found to have a better survival advantage. In a study that compared the PSAs of men who got Provenge, those men who had a PSA under 25 when they got started with Provenge lived on average about 10 months longer. So the survival advantage was the most in the men who had the lower numbers of PSA. So yeah, the guys who get Provenge, the men who get Provenge are just regular. You can't tell that they have advanced disease. Now, when I say advanced disease, it's the beginning of advanced disease. Now, if you are, you know, if your doctor doesn't expect you to live for another 6 months, okay, then you really shouldn't get Provenge because it's probably not going to help you because it's too late
What would
by that
what would
time.
the patient whose doctor said you won't live more than 6 months, what would that look like?
You know, they would
have
come in
metastasized
a
all over
wheelchair
his body.
because they have so much bone pain that they can't walk.
So he's metastasized all over, right?
Well,
Probably at 4,000
all over doesn't.
PSA.
Yeah, I mean,
Is that what you mean?
not necessarily. I mean, you can't go by PSA. You can't go by how many places the cancer has gone. You have to go by really your performance status, which means, are you able to walk? Are you able to take care of yourself? Are you able to go to the bathroom by yourself? You know, do you need someone to feed you? That kind of thing. Yeah, that's what I mean by your performance status, how strong you are. So a lot of men, you know, are candidates, even though
Do you have enough data to draw a probability curve, you know, like if they're taking this drug that they live with a 50% chance of living 2 years, there's a 20% chance of living 3 years, like 5% chance of living 5 years. Do you have enough data to draw a curve like that?
yeah, of course. I mean, it's not on this slide deck, unfortunately. I can show you afterwards if you like. They have something called a Kaplan-Meier curve for cancer statistics, and that's sort of the gold standard for cancer survival. And you know, it shows on one side, you know, what percentage of men are alive, and the x-axis is time. And over time, you know, it goes down. And they have one arm not treated with Provenge and one arm treated with Provenge, and there's a distinct separation in the curves. So is that what you're talking about?
Yeah, that's what I'm talking
Yeah,
about.
the Kaplan-Meier curve shows a distinct separation between the two, Provenge and not Provenge.
What's the longest? I mean, if you go out to the 5%, how long will those guys last? 5% of the patients last the longest.
I'd have to look. I don't know. I'm sorry. Yes?
I think I can address that, Bob. I know some healthy people that have gotten Provenge 5 years ago, and they're just as healthy today as I am, and they're going to live for a long time, so there is no end point. And they got Provenge, but one of the criteria for getting Provenge is you have to have hormone-resistant or castration-resistant prostate cancer. So they were in danger at the time, but they got Provenge 5 years ago, and they're still leading productive, healthy lives.
The other point is, in the community, at least, the problem we face is that it's not a pure study, because we're not just doing research to get a drug approved. So in the community, you take Provenge at an appropriate point in time, and then could be within the same year, you're still alive, and you're on to your next drug. So Provenge is not in place of additional therapy. It's a step in the progression of therapies.
Right. Like
There aren't a lot of men who in the community have only Provenge, and the data is collected and they all die out, and we can tell who lived longer and who lived less long, because when they start deteriorating in some meaningful manner, they get on to the next therapy.
Yeah, I
So
mean,
we don't have a pure study in the community.
right. I mean, the study's over. It's already generally accepted in the medical community that it extends survival. I mean, there are some sort of crazy outliers who try to attack the data and everything, but you know, it's pretty well generally accepted that immune therapy that Provenge does extend survival.
Well, I guess it's the classic question, like when you go to Las Vegas, how much, you want to know what's the probability I'm going to win, and therefore, how much money you're going to bet. So the patient is faced with the...
Right, okay, so let's say here, okay, so here's sorry. So this is a number that I talked about. So 3 years, these are men with advanced prostate cancer. In the study, 31% of them were alive after 3 years. Okay? The control group, 23% of them were alive. So about 8, almost 9% were more were alive. So that increases your chance of being alive by 22%. Does that answer your question?
Partially,
Yeah.
I don't pursue it.
Sure.
But I have a question, and my understanding is that these men, you have to have death events in order to get an FDA approval. So
Sure.
these men didn't get sequential therapies. They had to have a group who just had Provenge and who followed.
Right, correct.
But in the community, that's not how we're doing it. Is the point that I'm making. So we
Right,
don't have
it's
good.
sequential. It's a,
Yeah.
it's a sequence.
Yeah, we're not waiting for 3 years and only 31% to be survived. If you get the treatment, this is in the clinical setting, this study was what was needed to get the FDA approval to use the drug, but we're not using it this way. We're not giving you one drug and then watching you die off. We're giving you this drug because it's been proven to be beneficial, and then when some deterioration is noted, then we're giving you the next drug, and when you deteriorate again, we give you the next drug. And we don't have the kind of study that shows the answer to what you're asking, a really good question, but we don't have that kind of study. Number one, who would finance it? The only people who finance these drugs are drug companies, and they take people who are going to have events, because the FDA at this point in time is allowing drugs to get approved only when there are deaths occurred. You have to have a difference in death rate. That's what the requirement. There's been a lot of commotion about that. The FDA's requirements for approving drugs is so rigid that we have drugs that are hard to approve. But we don't use the drugs that way. Once they're out in the market, the only question is somebody going to pay for it? So in the clinical world, we're limited. Once the company gets a drug out in the market, only thing we have to hold us back from using it is good judgment, additional non-clinical studies, and patient's course. So we don't do 3 years like this. You get this drug, and I don't know what the number is. Maybe you're working for the company, right? Yeah. Do you have any idea? Can you give us a number? What percentage of men clinically get Provenge and within the year are on to another drug? It's a pretty significant percentage, right? Huh?
I don't think they've released that yet.
Oh, okay. Yes.
If they've released that, I don't think they've released that.
I don't think that study is being done, honestly.
Well, it's not a study anymore. It's just statistics of what happens after Provenge. And that's kind of what you're trying to get at. And when I talk to practicing oncologists, that's what is going on.
Your question is
Right.
exactly, what exactly? That after you get Provenge, then if you can get other stuff, or?
How do you, no, here's the question.
Sure.
When we look at these studies, they imply something that's not what's going on in the real world. These studies, look, 31% are alive at 3 years. We'd like to think that more than 31% would be alive in 3 years.
Yes.
And the only way you can have more than 31% alive is to have sequential treatments. So there are people who qualify for Provenge, and then they qualify for Xtandi, and then they qualify for the next treatment and the next treatment, and sequentially they're being kept alive clearly longer than they ever were. But this data here isn't exactly what you would get an answer from, because this is data that get an FDA approval. It's a subset, and it's based on the artificiality of what the FDA requires. And there's a lot of debate at academic meetings about the fact that the FDA's requirements, they don't allow any other stand-in for deaths. You have to have sicker people to get deaths. That's the problem with all the cancer drugs. You have to have sicker people, and then once the drug is out, then the medical community attempts to use it earlier and earlier. So Provenge, some people are saying, should be used earlier instead of waiting. But the thing that holds it back is money. You can't give anything that's not paid for. Most people can't afford it. But if you could, the talk is in terms of giving Provenge substantially earlier in the course, if you could. Same with the other drugs that we know about.
Well, I'm answering the classic question that faces cancer patients and probably other patients too. Is it worth it? In other words, every treatment costs you something in terms of money, quality of life, a whole bunch of things. There's negative things, and so what you got to say, is it worth it? In other words, if you look at a survival, for example, okay, is it worth? If you don't take something, you live 8 years. If
Yeah.
you take this thing, you live 10 years. Well, is it worth taking something that makes you live 10 years sick or 8 years?
Yeah,
well?
I
And
think
so
I think
it's-
from a patient's point of view, you have to look at it like it's almost a no-brainer if you're a candidate, because on one hand you have side effects, on the other hand you have benefit. A lot of patients will not opt for chemotherapy because the side effects are significant and the benefit is not even as much as Provenge, okay? Now, for Provenge, your benefit is significant and your side effects are quite small, quite minimal. So I think if you're a candidate for Provenge, I think it's almost a no-brainer. Now, if you throw in the finances, from a patient's point of view, financing, like I said, really is often not even a consideration because most patients have no out-of-pocket costs. So if you're thinking about, if you're a candidate for it, it's almost a no-brainer. That's my opinion, and I'm comfortable saying that to patients who come in to see me.
Does that mean that the reason it is only for advanced prostate cancer is holding it back, the cost, from being used for all prostate cancer?
Yeah, you know, if Provenge only costs $10, okay, and you know, if I,